Hi, I'm Sarah Dan. I'm an orthodontist straightening out the confusion and concern around orthodontic treatment by sharing some of my knowledge and expertise captured in my book, So Smile. In my book, So Smile, I talk a lot about early orthodontic assessment. I see this a very important first step for any child who might show signs of orthodontic problems occurring or developing. Parents often ask me, what are signs that I should take my child to an orthodontist? And although there's many, and I encourage you to see an orthodontist personally, there's a few that I can cover off here in this video. You might want to look out for things like early loss or late loss of baby teeth or irregular loss of baby teeth. You might look out for crowded or malpositioned teeth, crooked bites, children not chewing their food properly. There can also be functional things such as a child not speaking clearly, or breathing issues, which are more common nowadays, with sleep apnea and snoring being some of the hot topics in dentistry at the moment. Are any of these signs definitive? Not really, but they're a good indicator that you might require your child to have an early orthodontic assessment. Now, what I see often too is that parents are under some illusion that even though they spot these signs in their own child, they think that the child is going to somehow grow out of it. This rarely happens. In fact, what happens more often is that they then bring their child when they're 15 or 16 and most of their facial growth is complete, and therefore then a lot of the treatment options they would have had if they had treatment between the age of 7 or 10 are now no longer available to them. So the treatment now becomes more costly, invasive and complex, and basically it would have been much easier had they been to the orthodontist earlier. This is one of the things that I find most frustrating because it's so avoidable. If parents had been more educated in regards to this, then it would have been a much easier problem to solve. So if you see any of these signs or symptoms in your child, I encourage you to seek an orthodontic opinion early so that you can get treatment for these at the most appropriate time. This can make all the difference to your child's treatment, but also outcome. If you'd like more information, go to my website, drsarahdan.com.au. You'll find lots of great resources to help you navigate the orthodontic journey.